So the recording has started. So welcome to our two speakers. And I believe, Saira, you are the first one to speak. So a warm welcome to you. You're just down the road from me. We've had the most amazing weather today in the United Kingdom. We've had thunder and lightning and the most awful rainstorms, but we have sun right now. I hope you have in Birmingham, Saira. So a very warm welcome to you, and we look forward to hearing what you have to share with us. So please go ahead and upload your presentation.
Yes, of course. So thank you very much, Liz. It was beautiful and sunny in Birmingham, and all of a sudden it started to rain like crazy. So although we might not be in sunny Doha right now, Birmingham's a good second option, and I get to sit at home, so that's okay. Thank you very much to the committee for asking me to present today. My name is Saira Hussain. I work at Aston University within the Audiology department, and today I'd like to spend the next few minutes sharing with you a particular experience of interprofessional learning that we carry out at Aston University. We carry out lots of different varieties, and we actually hosted an event earlier this year. So I'd like to share with you my experience in terms of interprofessional learning with audiology and pharmacy students. There's more than just ears and drugs. So it might sound quite odd to begin with, audiology and pharmacy, hearing and medication, etc., if we're being quite simplistic. And we did have some students say something along the lines of, well, I don't understand what this has to do with us. And they're not wrong in thinking that. Interprofessional learning, we know, is something that is very beneficial, and especially when we think of healthcare courses and the role that these students will have in the future once they graduate. It is really important that we provide the experience and the opportunities for exposure to work with different colleagues and clinicians during the course and beyond. So if I tell you a little bit of background in terms of what we do here. So we know that IPL is interprofessional learning. It's an opportunity to work with different professionals. And if we're thinking about healthcare professionals in particular, which is my background and what we teach in our department, we're looking at educating healthcare professionals. It's so important that we think beyond our immediate roles and remits. And if COVID is anything to go by, we know that we've had people from all different aspects of healthcare working in ICU, being redeployed, being reassigned, being retrained. And actually, this is a fantastic opportunity to try and carry forward some of that shared learning and experiences that we've already had. We also know that it's valued by employers. So our students will go on to work in the National Health Service. They may go work for the private or independent sectors, again, within healthcare. And that means that we've got a range of employers who all know that it's really important that our students, once they graduate, know how to communicate with lots of different professionals. For example, they may be communicating with the general practitioners, they may be communicating with other departments. For audiology, that may be ear, nose and throat, it may be speech and language, it could be all sorts. And actually with pharmacy as well, that's the same. They may be working in hospitals, in communities, in, again, private places. And so it's important that they're not working in silos, and that we recognize that we all need to work together. And this is something that we obviously believe as part of the NHS. It's something that we believe in healthcare, and something that we promote at Aston as well, that the patient's at the heart of everything that we do. And if we have a patient that comes in for a particular condition or a particular appointment, that doesn't mean that we stop there. And it's so important that we think beyond our small roles and that we think of the wider picture. But why should we actually bother? So it sounds fantastic and it sounds like a great experience, and we know that there's a lot of research behind it. If we can try and support students very early on whilst they're with us in a safe environment. You know, they're practicing, they get to experience being a patient, they get to talk to one another, they get to find out about different courses, but also they find out about our roles and remits. What can a pharmacist find out from an audiologist? What can an audiologist find out from a pharmacist? And that's why we do try to implement these sessions. So if I tell you a little bit more about what we do in particular, so audiology at Aston is a 3-year degree, and we have our 2nd-year audiology students, and we have our 4th-year pharmacy students, so final year students, who will meet together in our clinical settings that we have at the university. At the moment, the ratio is around sort of 1 audiology student to about 3 pharmacy, and that's just because of the scope of the cohorts and the sizes that we have. We encourage them to dress professionally, so as they would when they are in their clinic environments, whether they are practicing in the labs, whether they're seeing patients, whether they're practicing on each other. It helps foster that the importance of a clinical setting and professionalism. We have 2-hour workshops, and we offer 2 different types. So unimaginatively, we have IPLA and we have IPLB, and I'll go through both of them with you. And we have an introductory session before we set them off, just so that they understand a little bit more about what IPL is, the fact that it's not going to be that scary, and we're here, like I said, in a safe environment, and our roles is there just to support them through these 2 hours. So when we set out these sessions, we do share obviously aims, and we talk about the purpose, which is to facilitate discussions between the 2 professions, to think about a multidisciplinary team that's working together, and to discuss some case studies from different healthcare backgrounds, again, to help improve patient outcomes, or think about how to improve patient outcomes. And our little caveat always, it's an opportunity for them to share and practice skills with each other. It's not an assessment. We do often get very nervous students walking in, usually pharmacy, come over to us and in their lovely white coats, and they just sat there slightly nervous, not realizing that the audiologists are only in 2nd year. And by the end, we do have fantastic feedback that I'd like to share with you as well. So they're the main aims, regardless of if it's IPLA or IPLB. So what we try to do is have sort of a knowledge scoping activity. We get them to talk about their professions. So who is an audiologist? What is our role? Oftentimes nobody's even heard of us, minus the pen, pardon the pen, apologies. We also talk about history taking and the role of that. So we know in pharmacy, they will be asking about medications, how they're getting on, any problems, symptoms, illnesses, etc. But in audiology, we are incredibly nosy. We like to find out, can people hear their grandchildren? Can they hear the fire alarm? Can they hear the doorbell? And they're not just because we want to know what's going on, but it's important for us to find out where it is that they may be struggling for both communication reasons, but also their own safety. And therefore, this is an opportunity for them to kind of compare the histories that we ask and the questions that we ask and the reasons behind it as well. So you'll find that the students will be sat there looking at the history sheets that we can provide them, have a discussion, practice doing histories on one another as well. They then get to be hands-on, and I'm a big believer in that. Once you've done something, it helps you understand the process as well. Now, you can see our lovely Fred the head here on the screen. We have many Freds in our labs, and what we do is have an audiology student demonstrate otoscopy, so looking in an ear. Now, that might sound quite simple, but actually the pharmacy students aren't allowed to look in each other's because it's not safe. And my role, and my colleagues actually on the call as well, we will walk around and check on the students and see how they're doing. They do, however, get to practice on Fred the head. And when they look in the ear, you can see lots of different conditions. We also know that in the future, roles are constantly changing, and something that we offer at Aston is an independent prescribing course, which means that graduates can continue their studies, and one of the areas that they do is to practice otoscopy, as that may be part of their roles in certain settings. And so just introducing them to the idea means that it's not so scary when they get around to it later on. So they get to have a look in ears. The audiologist may look in the pharmacy student ears as well. We talk about the questions that we may ask. We talk about what we may see, all the weird and wonderful things that we can come across in audiology. We also then demonstrate a hearing test. So we have the headphones in the room. It's not pictured just there on the screen, but they get an opportunity to sort of be a patient for us. And it means that audiology students get to practice their skills, again, with people who they may respond in a nice, safe environment. It means that they have the opportunity to kind of fumble their words or perhaps not do something correctly. It's just a nice, safe space. We love to do prizes, again, more so from my colleague. So you can see there, sorry, there's a bit of flash on my picture. But we have different cards, and what they need to do is match up some terms. So here we have different medications that could be quite common within the audiology world or that students may come across. Those in yellow then demonstrate how these medications work, and those in pink could show either the symptom that they may resolve or the symptoms that they could potentially cause. And the team that matches these up best in the sort of best match win some prizes. Usually chocolate is involved. So once they're warmed up and they have a little break, they then get given a case study. And within this case study, there's an audiogram, there's some information about the patient, and what they need to do is work together to present on the day. So again, that can cause a little bit of stress for some of the students, but we have been running this for many years now, and they all really enjoy it and they all get really stuck in. And just to make it a little bit more difficult, because obviously I'm very mean, we have the pharmacy student explain the audiogram, so the hearing test, and the audiology student explain the mechanism of the medication. And now we also tell them that the medication isn't necessarily what could cause a hearing loss, but we need to remember that the patient is a whole, and they may have lots of different medications, lots of different symptoms and illnesses that they may have, because they're a human. If I just skip to the next slide. So here's an example. So we get them to present on the history, the medication, test results, and next steps. And here's an example audiogram. That is one of our IPLs, and the other IPL, it's an opportunity to look at devices that help support patients. So thinking about, different pill bottles, thinking about patients that may have stroke and diabetes and the effect that that can have. If a patient has had a stroke and they can't physically lift an arm, how could they put a hearing aid in? If a patient isn't able to open a pill bottle, how are they then going to take their medications? And again, it's about recognizing our roles, but also the remits, but how else we can support a patient. Oftentimes we could be the gateway to further care, both for pharmacy and audiology. And it could be our role and our students' roles to refer on to their GP and think about the wider support that a GP may be able to provide. We did ask students for their feedback, and actually the overwhelming themes that we've had were around the importance of patient-centered care. Now, this isn't just a buzzword, and we across Aston are trying to support our students in recognizing the importance of patient-centered care. Within audiology, we are partners with a charity in Europe that look at audiology and rehabilitation and thinking about patient-centered care from that perspective. So trying to share what it is that we're learning from our collaborators. They recognize that it's important to work in a multidisciplinary team and thinking beyond, soundproof booths and other environments, and thinking about, well, actually, here's a patient I've got. They've got a stroke. They can no longer wear a hearing aid, but they're struggling here, there, and everywhere. Or they may have a patient that hasn't been seen in a while. And when we do a history in audiology, there's 15 medications. And actually, has anyone reviewed that in some time? We're not saying we're going to do that, but it gives us the opportunity to write that into our report and ask the GP to look into this. It also gives them the opportunity to interact with students that they might not have met. If I think about audiology at Aston, we're in our own separate building with optometry. So students are in different parts of campus, as you'd expect, but it gives them a chance to get to know one another, compare courses, think about assessments, and also their future roles and what it means. If we think about the big high street stores, particularly in the UK, but also in other parts of Europe and the world, you have the big brands that now have ophthalmic care, audiology, and pharmacists under one roof, and they are there working together and seeing the same patient. And there's an opportunity for them to practice clinical skills. It was a chance to communicate with one another. Our audiology students do get opportunities to speak to real patients, but also simulated patients quite early on in the course. And actually the pharmacy students found that they were quite confident and they managed to learn quite a lot from the audiology students and vice versa. And it's just a lovely teaching experience, because my role and my colleagues' role is to help facilitate the discussions that happen. We're not there to guide them and talk them through it. We're there to support them in having those conversations in a structured way. So I do have some feedback here, and my head's covering one of them, but we had things like the audiology students are very professional and clearly confident working with patients, which is fantastic. And it meant that they acted as role models for the pharmacy students who were quite close to finishing the course and graduating and applying for jobs. It was a great session interacting with other healthcare professionals. And again, that's so important. I suppose the only real life experiences that they get until they go out on placement or until they get their real life jobs is what they see on TV. And there's honestly a big disparity in how healthcare actually works, and perhaps a hierarchy that we don't want to encourage. And it's something that I know we are looking into and supporting them early on. It was an opportunity to discuss patient cases from different angles. Again, thinking about the patient as a whole is really important. It was an informative session and was interesting to see how we pharmacists can help give better advice to patients. So they were thinking particularly in terms of patients that may come in, they may have sigma ear pain, or they think they've got earwax, etc. What is it a pharmacist can do? If a pharmacist sees a patient and identifies perhaps some cues that show that the patient perhaps isn't hearing quite so well, what are the steps to get a referral? And the final one, if I just move my head that way, how different healthcare professionals are involved in all aspects of patient care. Again, just showing that your role doesn't end when your patient leaves the room. You may then need to support them getting to the next appointment. You may need to call, the ambulance support service to take them home. You may need to think about wider referrals, etc. So here's some feedback that we gathered from our students. So we've run this over several iterations. It's the same session, just with different students because of the sheer number of pharmacy students and also the room capacity as well. And what they found was that they really enjoy the staff support, sharing the cases, group working, but most of all, they loved meeting students from another course, especially as it can get quite siloed when you're studying your own different courses. And if we think about IPLB, again, we had more matching tasks, more chocolate prizes. And again, it gave them an opportunity to speak to one another. And you can see there that we had really great feedback. 5 was obviously the most enjoyable / beneficial, and 1 was the least beneficial. And luckily, I'm only seeing a few ones. So the final thought here is, students sharing with us that they're not as isolated as I thought. The professions do work together. And as much as we can preach it, we need to make sure that we are practicing it and giving them opportunities to practice too. It's been a really interesting experience. It's something that we've run for a number of years. And if I talk to you about future plans briefly, so we want to involve other degree programs within audiology. As a whole, Aston does put on various IPL sessions. So for example, all year one students across medicine, pharmacy, optometry and audiology will have a professional values and equality and diversity sessions that are run by the medical school. We would like to work with the wider university. We have psychology students, those that work in biosciences, etc. And they may be working with patients directly or indirectly in the future. And therefore, it's really important that we can try and share and foster some skills, shared skills. The use of reflections are really important. So we do have students reflect on the experiences. It's something that they have to do as part of their registrations once they qualify. And again, it gives them an opportunity to reflect upon. And it varies in terms of whether it carries any credits across the courses. There's a question mark there because we're currently going through a process of changing our credit sizes. And again, like I said, it'll be interesting to see if we could do something like this across universities. We have lots of local ones. I know there's a few people in the chat as well. So please do email if this sounds like something that we could try and implement on a bigger scale. There's a few references there. And finally, here's my email address. Should you wish to contact me, I'm more than happy to answer any questions in the future. And that's it from me. So I open it out to you for any questions. Thank you for listening.
Well, Saira, that's just an amazing start to the afternoon. What a lovely presentation style you have. And do you know what? I just love the fact it's simple. Sometimes two professions coming together, we can achieve so much. And it's very inspiring that you've got so much active learning going on in your sessions and that you're getting such positive evaluations. So well done. So I, with Richard, will have... Okay. Yeah. Okay. You're very welcome to come and present from Germany. I don't know what the weather's like over there for you, but you're very welcome.
Yeah, thank you very much. I will share the... Yes, I hope you can see this. Yeah, do you can see this?
Perfect, thank you.
Thanks. Yes, very great presentation you've done. Now I will come from practice and education to research in IPE. So I want to introduce to you the Interprofessional Teaching in Healthcare and Interprofessional Graduate Program in Germany. It is called ILEGRA. ILEGRA is a short form of the graduate program in German. I want to say just a short overview. I want to talk a little bit about the ILEGRA, the structure, the program, and some of the all of the research projects, and also the challenges we had and we have. What is at the moment, and a short summary. Yeah, ILEGRA. ILEGRA is a structured interprofessional PhD program in Germany. It is it started in October 2018 and will last till March 2022. It is a cooperation of the Ludwig Maximilians University, short LMU, in Munich and the university in Osnabrück. And it is funded by the Robert Bosch Foundation. This is a really well-known foundation which supported IPE in Germany. It was planned for 12 fellows of academically qualified healthcare professions. And every fellow has 3 supervisors for their dissertation, 2 from the home university, and 1 of them are in national or international expert in IPE. To the aim of ILEGRA, I just have to say something about IPE in Germany. IPE is a really new topic, and it's only a few years ago that it started in the mindset of our responsible persons in the universities or in the training centers. And so it is quite new also in practice, interprofessional collaboration, education, and also in research. So these aims are really orientated to improve the collaboration and, of course, patient care. And this is all in a time while education of health professionals are really in discussion and are in a changing process in Germany. So it contains improving collaboration in healthcare by qualifying and promoting young scientists for interprofessional teaching and research. Graduates should become visible with their findings in the field of education and practice. I told this is really new for us. And professionalization of professional teaching and research in healthcare and education. This is very close to our change in our education of the health professionals. And of course, reduction of interprofessional interface problems. This is a very full slide. This is an overview of our core team of ILEGRA. We have 2 heads. One is in Osnabrück at the university. This is Professor Ursula Walkenhorst, and my boss is Professor Martin Fischer in Munich. I share the coordination position with my colleague Christine Woltering, so that we have 2 contact persons, one at every location. And we are really good supported by our secretaries. The next important part is the scientific board. These are professors responsible for the applications. These are supervisors, or lecturers, contact persons for or any support for the students. The next important board is the International Advisory Board. This contains Professor Simon Kitto from Canada, Professor Museus from Denmark, from Germany, Professor Nauert, Professor Tippett also from Germany, Professor Jill Thistlethwaite from Australia, and Professor Christoph Zalpur from Germany. So we have every year a meeting with the Interprofessional Advisory Board, and we something about the process in ILEGRA, the success, and also our challenges, and they give also advice. They are also contact persons for the students and for networking. And based on this all is the Robert Bosch Stiftung. It is special from Irina Zichon, the senior project manager, and Kerstin Spenger. These both persons support us really good, and not only with the financial support, they support us also with the conviction on our work. They believe in it, and they say it's really important what we do, and they find it really good. Yeah, I want to talk a little bit about the application. At first, we introduced ILEGRA in some German networks, journals, conferences to motivate the students for an application. The students had to write a study proposal about a topic in interprofessional education, mediation, evaluation, examination, something about this. And then they had to present their proposal to the scientific board. They were interviewed, and they were, of course, rated. Then we had several interviews. We had 18 applications in Osnabrück and 15 in Munich, and 10 interviews, and also 13 interviews in Munich. I've told you it was planned for 12 fellows, so 6 in Osnabrück and also 6 in Munich. We started with 6 fellows and 1 associated fellow in Osnabrück, and also 3 in in Munich. It was so that in the application process, we discovered that the people had really impressive proposals. And so we had to check the financial situation. We decided to offer a special possibility for the people. They get no paid scholarship, but they can take part in the program without any costs. And I saw Angelika Simonsson is one of the associated fellows. She's also here in this Zoom. And then you can see also we have different professions. It's a difference. In Osnabrück, the main focus is on therapy. And in Munich, we have also nurses and physicians here in our team. Yeah, we started. I introduce you the semesters, the years. And at first it was very important with our aims. At first it was based on their proposals. They need to specify their job subject and about literature research, about theories and also methods, what they can do. Then it was also a very important part of our program that we offered monthly colloquia, and the students had to write 2 qualifying papers in this year. And these qualifying papers are part of their dissertations. And also they have the possibility to go to some trainings which they are offered from the university, also in Munich and also in Osnabrück. We started in November in 2018. It was a really nice start for us because we started with a cooking event for team building. And yeah, in Ratzeburg, it is a cute little town in Germany. But then we had the focus on Berlin, Munich, or Osnabrück. So we had a interprofessional international advisory board meeting, a kick-off event in Berlin, and also then different work in the year. In June, we had a special guest, Jill Thistlethwaite was in Munich. It was really good for us, and so the students had very much impact from her. And then we had summer workshops, and also you can see the last part of the aims, the work on the individual scientific portfolio. They started at the conference of German Medical Education Association, GMA. It's very well known in Germany for us, and it was the first time that the students had a workshop and they presented their topics and discussed it with the participants of the workshop. The next year there was focus on theory and also on generation of data. Yeah. It was a break there. We started really good. It's also a symposium in Berlin, workshops in Osnabrück, the International Advisory Board meeting, workshops, another conferences. And then the break was caused by the coronavirus. No one was interested in this time to take part in studies. No one had time to take part in these studies. It was a very difficult time for them. And then we changed our program into online. We planned also for the spring in 2020 to take part in a special workshop at the Atelier program at the Wilson Center in Toronto. It was planned that the whole group have a trip to Canada, but yeah, we had a problem with Corona. Yeah, the final time. Here's the AIM presentation and discussion of the research results. Now we had a delay, of course, with data collection of the last year. But now we are really in a good time. Yeah. Yes, we did the Atelier program, delayed, but we did it all online. So it was in the November 2020. And then you can saw also the scientific retreats. We planned to go to another location for and for meeting, but all this changed on the online format. And then we also had the International Advisory Board meeting. It was also online workshops, and we had a summer meeting, and also the GMA conference also online. And some of the fellows did also a presentation there, or they had a poster. Then we are in preparing very soon our autumn meeting, and then the closing event of ILEGRA in April, and also a special ILEGRA slot at the GMA in 2023. Yeah, these are the research projects. I'm sorry for that very short title. These are only, I could not mention the target groups, and it's only very short that you have an overview. So I want only to bring you really the broad spectrum of the focus interest of the students. Yeah, it is about teacher beliefs, about teaching. It's about teaching principles of learning facilitators at the interprofessional training ward. It's about the timing of IPE. One fellow developed an interactive learning concept, and she evaluated it. And it's also about e-learning, synchronous digital learning scenarios for interprofessional learning, interprofessional teaching learning concepts as a prerequisite for interprofessional collaboration. And one of the students analyzed the conservation of students from different health professions during casework. Yes, this was all in an interprofessional context. And from Munich, we had in focus, one student had in focus the power in the interprofessional collaboration practice. One topic is about psychological safety. It's also in practice. Interprofessional case discussions and ward rounds. It's about interprofessional communication. The interprofessional handling of a virtual medical class. Online learning on the interprofessional competence development is the dissertation Angelica, and something about professional identity and interprofessional cooperation, problem-solving process during an interprofessional escape room. This is also really interesting because it's a play, and to play together is also something about learning together. And interprofessional patient handovers in the field of discharge planning. So I hope I made you interested in all these topics, what our students thought they are really, really interesting for them. Yeah, we had challenges. At first, a problem was in a very long vacant position of the coordination and secretary. This was in the application process, so it was only much work for only a few people, but we solved this problem. Yeah, we had dropouts and we had breaks. I have to a little bit talk about this. Medical students have to do their study in addition to their regular studies, and they have only one semester free to do their dissertation. It's really short time, especially when we see the difference to the full-time scholarships of the others in ILEGRA. So this lead to a workload and also mental stress. So 2 of the medical students dropped out. It was very sad, but yeah, that's yeah. Yeah, also we had challenges of life. One of us had problems with a long COVID syndrome. There were other illness. They had problems with homeschooling, and this was a really stressful time for the fellows, and also very stressful. But it caused a nice break, a break due to a pregnancy. Yeah, this was the most challenging part of ILEGRA. It caused changes in the course of the program for us, for my colleague and me, and for the students, necessary adaptations in some studies, for example, the group work. And they have to change all their questions and also their design. And I've already told this that no one was really interested in this time to take part in studies. So this leads all to a delayed data collection. But we are really lucky that the foundation was so friendly that we can extend the project duration because we had money free from our planned journeys, and so we can do some reallocations so that our program is not 3 years. This is now 3.5 years. Yeah, and also we want to build a mutual understanding despite different cultures. We discussed it, and we had really an eye on regular exchanges. Yeah, at the moment, the data collections are largely finished. Most of the fellows are in the last phase of the dissertation. The fellows start looking for employment after ILEGRA, and we are in work of a book with summarized results of ILEGRA. Yeah, I know you cannot read this, but I want to show you that our students worked hard on their professional portfolio. This is all in the time of ILEGRA, and we are very proud about this. Summary: ILEGRA is a founded, unique 3.5 year structured PhD program. We have 15 fellows from different health professions. The program offers the support of national and international experts from the field of research, education, interprofessional education and practice, the development of research competence, and the ILEGRA studies contribute to a deeper insight into interprofessional teaching and research. The graduates are visible in different networks or science communities get attention with their findings. Yeah, and the project ILEGRA ends in March 2022, and a repetition is not planned. However, committees in Germany responsible for the academic training of health professionals started discussing to open their PhD programs for other professions. So it said that the program of ILEGRA will end, but it made some change in our education society, so that they discovered really the need for more exchange, and also exchange and collaboration in research. Thank you very much for your attention. Best greetings.
Well, thank you very much indeed, Birgit, for taking us through what seems like a wonderful program, because all of us here would agree there is nothing better than PhD students to shine a really strong light on a problem and dig deeply to solve it. I'd like to partly feel the UK could own Robert Bosch Foundation, because I've been to several things where he's been supporting, or the foundation has been supporting, interprofessional education. It's fantastic that you can use money so wisely, but most of us probably have three PhD students under our shoulders and feel overwhelmed by that. 12 seems amazing. So well done, and how interesting. So there are lots of questions I think I can see. So we'll see what people want to say before I say any more. Richard, you wanted to ask, did you?
No, I was actually clapping for the presentation because I thought it was excellent, very detailed, lots of information there. And let's fingers crossed that you may get further funding to continue it in some way. I may have missed it, but it was one of the abbreviations. What does GMA stand for, Birgit?
GMA is German Medical Education Association, and GMA, and we have also annual conference, and also it's a journal, GMS, and it's very well known in Germany and also in Switzerland and Austria. It's an association.
Yeah. Is it very supportive of the work you've done? Is there potential that they could help?
Yes, they are really interested in interprofessional education. For example, we have some people are working in the GMA in a part. Marion Huber is here, the first person here, and the interest is in interprofessional education is there for a long time, but they were not really they did not really support it with the financial support, but with their interest, and they wrote some papers about interprofessional education, and there are some really people, they are motivated to push interprofessional education in Germany. Marion, is it correct? Would you add something?
I can't add anything. You did well. Yeah, I think it's a very important platform. I think the problem will be that the association is not really give money to specific projects, and but they will support for finding funding. So yeah, I think this will be a problem for ILEGRA or not.
Yeah.
Just to pick up, we have some questions.
Yeah, please.
Katja and Johanna. So I don't know who'd like to go first.
Actually, I didn't have a question in a first thinking, but well, I would actually right now. So thanks for the talk. I mean, it's an amazing, very comprehensive program, and too bad it didn't go on. And still, I think we will do quite a lot actually to get more influence there with all the academization of the health professions that we do now go on in Germany with. What I would like to know though is do you keep up where your graduates actually go to? So where do they find their jobs, and have they any way of influencing you know, that this kind of idea, this program might be kept up?
Okay, some of the fellows are really interested to go to universities as professors, and so we hope they will have their influence about interprofessional education and can push this also in research and in education, I would say. And some of the fellows will be in they are already in universities and do their work there. So it's really good for us. Yeah. Yeah.
Thank you, Birgit. It was really nice to listen to your presentation, and I'm always amazed. You Germans are always very organized when you do things.